You've just met with the Foreign Minister Marise Payne on this very issue this morning. Are you satisfied with the government's response? What else can Australia do at this point to help our neighbours with this crisis?
Yeah, well, we met particularly with the Aid Minister, Zed Zaljic, and Cabinet was discussing this as really their top priority issue last night. There will be an announcement soon. This is quite devastating. If it's 1 in 3 who they're testing who are positive, it says this is a health catastrophe and already has run away. And no longer can Australians say, yeah, but the vaccines are only for us. This is really now a domestic issue because so many people have come into Cairns Hospital, which is on orange alert from PNG with COVID. The Premier of Queensland desperately worried. There's only 4 kilometres of water between really Australia and PNG. So the understanding that this really is now our issue and we must step up with vaccines and with testing kits and do so massively is not just right for PNG, but it is right to protect ourselves, actually.
You mentioned an infection rate of 1 in 3. We've been reporting on the fact that capacity in terms of the healthcare system is being really tested. What's your understanding of just how bad things are on the ground there at the moment?
Look, our understanding is we'll know in 2 weeks particularly how shocking things are. They're bad now, but Michael Somare, the founding Prime Minister, has just had massive funerals in Port Moresby and Wewak with tens of thousands of people, which will be a spreader, super spreader. We'll know in 14 days just how much. But we know that in PNG, which had done really well in keeping the virus out, it is so fragile in its health system, so little testing kits and ICU ventilators that now the morgues already can't contain all the bodies. This is in a very humid country. So this is apocalyptic in the sense of a disaster unfolding that does directly affect us.
Yeah, you're making that point that this is now our problem, but there would be a section of the public who might be thinking, well, hang on, we don't have the supplies here yet for Australians to be vaccinated. Shouldn't we be looking after our own taxpayers first?
Yeah, look, we need to do both. The truth is that young, healthy Australians getting the vaccine when frontline workers in PNG and so many others there can't get the vaccine just doesn't make moral sense. We know that we have still largely dodged a bullet. The truth is most Australians do not begrudge helping our neighbours, particularly frontline workers in places like PNG where it's starting to rage, when we are largely still safe. Sure, vaccine nationalism is appealing to some people to say just look after ourselves and build a wall or put up a fence, but what the invisible virus has taught us is we are biologically connected. We are utterly interdependent. It doesn't end for us until it ends for all of us, particularly those of our immediate neighbours so close to us. We have to think rationally about this, not nationalistically about this.